Well, this is thread, and useful in terms of explaining why you get pain, but a disc is not the only reason why you might have back pain. But I thought I'd bring thread because you can see much more clearly what's going on when you look at a skeleton.
Can you just explain all the different bits that thread has there, and what each different coloured bit is?
Okay, well, these are Fred's hips here. This is his sacrum, that's the bone at the very base of the spine. These are all the individual vertebrae, the lumbar vertebrae. This would be his head up here and his skull. These yellow bits of plastic coming out at the side between the vertebrae represent the nerves, which are really important because that's what keeps you happy, keeps you moving, and if they're not happy, that's why you have pain.
So when Fred or anybody else has back pain, what happens in that diagram?
Well, what happens is anyone can get pain when you close the space where the nerves emerge. It just takes one of these vertebrae to move up a bit or sideways a bit, and you can see that that area in there becomes smaller, right? Nerves are basically like light switches. They're either on or they're off. They have no dimmer facility. So it might get a little bit smaller in there and you don't notice anything. And then suddenly you go a millimetre more and bang, you can't move. And the reason is you're setting up, when you make the hole smaller, the fluid pressure around these nerves goes up. And when it reaches a critical level, the nerve fires. So this is why osteopathy works, because what you do is you move the vertebrae back into position, loosen the muscles up, and lo and behold, you've got more space. Also, that's when it's really simple. If you have back pain, that's what you hope you have, because that's the easy stuff, right? If you're a little bit less lucky, you may have a situation where what happens is the disc, which are these pads between the vertebrae, which act as shock absorbers, if something happens to one of these discs. Now, what happens here is the outside of the disc is ligament, and the inside is jelly. So here you've got basically a series of bricks stacked on layers of balls of jelly that are covered in ligament. If that wall of the ligament bulges, that bulge can go back into the space where the nerve is, and you'll have pain. Or, sometimes what happens is the ligament can tear, and because again you've got bricks, vertebrae stacked on top of each other, what happens is the jelly in the middle of the disc will come out through the space where the wall of the disc is torn, and again you've got a problem because it goes back onto the nerve. So that's a slightly different case scenario.
Can osteopathy still help that then?
Osteopathy can still help that because it's often possible, not always, 5% of cases have to have surgery, but an awful lot of people are helped by osteopathy because we don't manipulate in the area when you have a disc problem, not usually. What we try and do is get the mechanics of the rest of the spine working, open this space out. For example, one of the things that we do that really helps is we'll get people to lie on their sides. So if it is a disc problem and the jelly is extruded, you open it out like that, you rest in that position, the jelly can fall back into position, you have ice packs and things, and then you've just got to take care of it. I'm afraid a disc is more of a problem than just the vertebrae going out. A disc will take 12 weeks to heal. But if it's just a case of something's out with your back, you can be better, you can be feeling better almost immediately, and better perhaps in 3 to 6 sessions.
And if people wanted to have osteopathy, or to find out more about your osteopathy, is there a website they can go to?
They can go to www.livinghealthily.com. Please check me out there.